Good morning, Welcome Waggin community. It is Dr. Jenny here. Cheers with your morning coffee. We are back, or I am back, for another episode of Morning Coffee Talk with the Welcome Waggin. Again, I'm your host, Dr. Jenny, and I am excited to be here yet again for another episode about, this week is going to be about cats. Cats. Saturday is National Cat Day, so what better time than now to start talking about the importance of keeping our cats healthy, safe, and happy. So as always, our mission here at the Welcome Waggin is to celebrate life and the human-animal bond. We do that by providing exceptional veterinary care in the place pets love most of their home. And this series is more to connect with you guys, our clients, and create a community-based series about how to enrich our pets' lives. So each week we're going to be diving into different topics that I hope will just spark interest and curiosity about your pets, about veterinary medicine, about how you can just keep them living for as long as possible and keep them living well for as long as possible. So each week I like to start with just some week updates and kind of what's been going on with the Welcome Waggin. So let me take a sip of my hot coffee and we will get started. So wasn't the weather so nice over the weekend? Even this morning, just coming to work, it was just so beautiful. We are having such a wonderful fall. So to all of those who mainly are watching in the Chicago area, cheers to having an amazing fall, even though my kids are sick. So I have a 7-year-old and an almost 6-year-old, and both are down with fevers right now. So we didn't get to enjoy the lovely weekend weather as much as I would have hoped. But here at the Welcome Waggin, we had a great week last week. It was celebrating the veterinary technicians. So if you missed the live last week, we are working on posting the YouTube video of it because I did interview all of our technicians and I want you to listen to their amazing interviews and just learn more about them. So as I am learning and promoting this coffee talk series, I am learning a lot about technology, and uploading videos on my phone was much harder than I thought it was going to be. So stay tuned, there was a little bit of delay with that. But part of our celebrations was, again, I really just wanted to pamper them and give them all the thanks for all the hard work over the past year. And so health and wellness is something that's very important to us. As a general practitioner myself, I believe preventative medicine is the best medicine. And recognizing in yourself when you are getting stressed out, burned out, all of those things coming up for people, especially in, I guess, just the society we live in today, it's just super important. So I wanted to really focus on their health and well-being last week. And so this week we had our monthly team meeting yesterday, and I had asked my personal trainer, Suzuka Enrich, shout out to Suzuka, anyone in this area in search of a personal trainer or someone to help just do what we did yesterday, which was a little business event workout. Definitely reach out to her. I will give you her contact information. I'm sure she will say that would be okay to do so. But anyway, we had Suzuka come lead a yoga session for us, and it was refreshing. It was sweaty. I think Sarah specifically and Karina didn't realize how sweaty they were going to get, and even Annette. So it was just a lot of fun to be able to do that yoga session with them. So we concluded our week of celebration, even though we should be celebrating every day, which we will. But we really wanted to just do a lot of good stuff for them. So that was really awesome. I may have her come back once a month for something. She said when we get really stressed out, we could do a kickboxing course or something, or class or something like that. I think that would be really fun. So that was one fun week update. Other updates, again, I said we had our monthly meeting, and it was really just exciting and refreshing. You know, we've been really trying to build the Welcome Waggin into a sustainable business to where we could reach more pet parents over the past 2 years. And like everyone in the vet field, having a lot of growth has just happened, but trying to actually grow a business at the same time has been interesting. And so this meeting was really awesome because I feel like we've gotten to a point with our processes to where we're really honing in just our customer service skill set versus trying to do deep dive of processes. And we are open to any feedback that you guys have as our clients on ways that we could better serve you. So yeah, let us know what we could do better. Let us know what you're already loving so we could continue that, especially since we have grown from just Sarah all those years, 2 years ago, to Sarah and Christy, to now our team of 11. So that's something that's really important too. And then last update, this weekend on Saturday, it is the Downtown Plainfield Spooktacular event, and I cannot wait for it. We literally moved in last year and then just randomly decided to do it, and it was so much fun. There were thousands of kids out there with their little trick-or-treating bags and their cute little costumes, and we can't wait to do it again this Saturday. So if you are around Plainfield, definitely go online and check out the Spooktacular event and stop by our table on Saturday. I believe it's from 11 to 1, and say hi to us. We can't wait to see you and just get some in-person updates from you as well. So let's get going into our topic this week. This week we are going to talk about the top 5 cat diseases that we see here at the Welcome Waggin. And really, I think those are just the top 5 cat diseases that almost every brick and mortar GP practice sees. I was looking up some research and just like our own patient dashboard, and we are really pretty much in line with the standard practices. Our patients are 60% dogs and 40% cats. And so what we know is, yes, there are more dog owners out there, but there are still millions of cats in households. And so really that number should be more like 50-50. And there are many people that are not bringing their cat to the vet or having us come to you, which is even better, right? So I really want to just talk about the top 5 diseases that we see out in practice, in hopes that if you start seeing those changes with your cats, and honestly, before you see those changes with your cats, we should be doing annual physical exams on your cats every year. Once they turn 7 years old, they are considered seniors, so we should be doing semi-annual exams to be listening to their heart, to be feeling their kidneys, feeling their abdomen, looking at their teeth, and all of those things to make sure that we are finding anything that is changing earlier, so it's not too late with cats. So the number one thing and why this is so important is because so many times, cats have a weird lifespan. They could live 20 plus years, but the reality is they start becoming seniors around that 7 to 8 mark. So there's this long gap of how is a cat going to make it to that geriatric. So after 15 years, we're looking at cats becoming geriatric at that point in time. And so many people, it almost is too late by the time that their cat starts presenting to them that they're sick, because cats are stoic, they mask clinical signs, and they don't always show us. So in the wild, cats are more solitary creatures, and so they're not the pack animals that our dogs are. And so it would make sense that they are going to mask those signs, which makes it even more important to have those preventative visits so we could start monitoring the diseases faster. Because we know as veterinarians that, our body does not live forever. The heart cannot keep pumping forever, and eventually our organs are not going to work as properly. So we know those common diseases, and we could help you guys start watching them. So let's talk about those diseases. No particular order. Some of these are probably, I think the last one's number 1 is probably, I would say, the most common disease in cats, but no particular order for the other ones. So number 5 is heart disease. So heart disease can be super scary in cats because the number 1 cause of sudden death in a cat is most likely heart disease. It could be from heartworm disease itself or just underlying heart disease that went undetected. Cats tend to get what's called hypertrophic cardiomyopathy. So big fancy word for hypertrophic, meaning getting bigger and thicker. So their heart muscle starts to thicken, which makes it harder for their blood to pump. And usually we'll hear a murmur with them. So that is one where we should always, every year, you should have your cat's heart ausculted by the veterinarian, again, semi-annual when they are older, to make sure we don't hear any heart murmurs. My cat, who lived to 20, had kidney disease and heart disease, and we were monitoring that heart murmur because eventually what was happening with him is one of his chambers in his heart, the blood was starting to pool because his heart the valves weren't pumping properly, and he was at risk of developing a blood clot. So heart disease in cats is a serious disease. Here at the Welcome Waggin, it is our #1 limitation. So again, we don't have x-ray capabilities, and so a lot of times when we're working up a cat case with a heart murmur, we want to take x-rays, because what you're looking for in a cat is like their heart literally almost looks like the Valentine's heart, the way it's shaped. So we're looking for that shaping to say like, okay, yeah, those muscular walls are getting thicker. And then obviously checking for making sure they don't get heart failure as well. Cats tend to get left-sided heart failure, which means fluid's going to build up in their lungs. And then the other thing that we don't have right now is we have abdominal ultrasound capabilities, but we don't have ability to do an ultrasound of the heart. So there may be times that we are referring you to a cardiologist in the Chicagoland area, and we do think it's very important to go see that cardiologist because we want to get a look inside the heart and learn what valves aren't working properly. Is the blood starting to swish and pull, which means that clot formation could happen faster? All those things. So heart disease, #5. Again, I could talk about each disease longer. I'll try to keep this no more than 20 to 30 minutes. So we're going to do a quick whirl of all these diseases. If there's anything that you want to know more about them, comment below, ask your questions, and we'll keep the conversation going. #4, diabetes in cats. So in humans, we hear a lot about diabetes. We hear about type 1 diabetics and type 2 diabetics. So cat and dogs don't follow a class of like, we don't call it type 1 or type 2. However, cats do tend to mimic human type 2 diabetes where there is insulin resistance. So many times with cats, this is a disease that happens from some sort of insulin resistance. And like humans with the type 2, a lot of it is a predetermining factor is from cats just being overweight. So it is something that is becoming more prevalent in our feline patients because of the obesity of those patients. And so keeping your cat nice and trim is super important. Again, go see, I think, another episode where we talked about pet obesity in ways that we can keep our cats nice and trim, especially our indoor cats who are not exercising as frequently and eating a lot of dry food. And so with diabetes, you are going to see peeing more in the litter box. That's the #1 thing that I'll notice. And then all of a sudden you'll start seeing weight loss, unexpected weight loss. All of those things definitely trigger me to let's check and make sure we're not diabetic. Sometimes you'll see vomiting. Again, because there tends to be insulin resistance, there's other diseases that kind of go along with cat diabetes that we're going to be monitoring for as well. So this is a super common disease that can be treated. There's a diet, but most of the times cats do need insulin. So a lot of humans will start with like oral medication that lowers their blood glucose. That doesn't work as well in our cat patients, and so it is teaching our clients who have diabetic patients how to give insulin injections every 12 hours. So it's a very serious disease, and one that if we could keep our cats trim is a good way of trying to avoid that disease. So #3 would be GI diseases. So inflammatory bowel disease and GI lymphoma are diseases that this is one I can't say like we're diagnosing, but we're suspecting based on what's going on with the cat. And so one of the things that I think is a huge myth and misconception amongst cat people is that it's normal for my cat to vomit. And I always say it's not normal for anyone to vomit as much as like we allow cats to vomit before we think that it's a problem. A hairball every now and then, that's one thing. But I tell people if you are noticing your cat vomit weekly, especially more than weekly or definitely a couple times a month, that definitely would be a trigger to me that there could be something else going on, and we should definitely start looking for blood work. So vomiting and diarrhea are the most common causes of GI disease. There's acute GI disease, and then the chronic one, which I'm talking about, would be vomiting, diarrhea more than 3 weeks or more. Is when we'll start thinking, okay, this is more of a chronic case and situation. And so again, we don't know what is causing these diseases. Sometimes we think it is a food allergy or just an allergic event. Other times we think there is some pathogen that we just haven't been able to identify. But I am seeing, probably because of my interest in GI disease, but I am seeing more and more cats with underlying GI disease. And the reality where I said like we can't get a full diagnosis is you're not going to get a full diagnosis until you actually collect biopsy samples, which would either be through endoscopy or surgery. And not every cat owner will go through all of the testing. So there's definitely stages of testing to fully diagnose GI disease. I did the testing in my own cat because I have a history of my own personal GI issues. I've been scoped before, and so I wanted those diagnosis because I had a cat literally when my daughter turned 1 year old and we carpeted, got all fresh new carpet in our basement, decided to start having massive diarrhea from inflammatory bowel disease. Thank you very much, Ricky. And that prompted me to start looking further into his diagnosis. And so what you're going to notice is you are going to notice again, vomiting. Vomiting is one of the biggest clinical signs that vomiting is not normal in a cat. You're going to be noticing weight loss. You could be noticing changes in appetite, and then diarrhea, all of those different things. And so when you come to us, what we're going to do is we're going to take some blood work and do our basic blood work and look at our liver values, kidney values, blood glucose, kind of start ruling out everything. And when everything's coming back normal, that's when I start thinking, okay, this could be GI disease. And so here we'll have Dr. Rump do an abdominal ultrasound and look at the intestinal thickening, look at the stomach and all of those types of things. And then we'll also do a GI panel. And that's the extent of our ability to work up GI disease. But there's a lot of treatment options we could do from that. And then it's having to refer to a specialist to actually get a diagnosis of that GI disease. Cats tend to get B12 deficient. We're even seeing it in dogs too. And B12 deficiency, B12 is part of your small intestines. And that absorption is super important and able to make sure you're getting your micronutrients. So making sure that cats aren't B12 deficient is something that's huge that we could do through the GI panel. And that also is important because so many humans are now becoming B12 deficient, and that's a whole other story of different areas that causes as well. So number 2 is hyperthyroidism, so an overactive thyroid gland in cats. So dogs tend to get hypothyroidism where their metabolism is very slow, and cats tend to get hyperthyroidism. And that is, my cat Lucy now has hyperthyroidism. So I feel like I've got every cat disease I've probably had with amongst my cats. My dogs are doing pretty well so far. So I have a 15-year-old cat, Miss Lucy, and she's got thyroid disease right now that we've been treating with medication since she's had it. And hyperthyroidism long-term can cause lots of different complications as well. So it's really important to have that diagnosed. I see many people with their cats 15 plus that are saying, my cat has a voracious appetite, my cat is super talkative, and that always wasn't the case. My cat is vomiting. All of those things are going to make me think, oh yeah, we definitely have a hyperthyroid kitty on our hands right now, and that is something that's treatable. Lucy, I think, oh gosh, she probably was diagnosed when she was 12. I felt like she was a little too young, but I've seen hyperthyroid as young as 7 years old. So any of those changes, especially with the voracious appetite, I've known hyperthyroid kitties to like all of a sudden start stealing food off of people's plates like they never were like a people table food eater, and now all of a sudden they're doing that. Those are some things that I've seen as well. So eventually, cats can, I mean, all these diseases untreated will just leave your cat not living their full lifespan. And so it's really important to monitor these. And really, of those all right now, I mean, diabetes and giving insulin injections are the hardest ones to treat. But which leads me to our number one disease or systems of diseases that I see in our cats, and that is kidney disease or feline lower urinary tract disease. So and this is anecdotal, I feel that almost all cats, if they're going to live long enough, eventually their kidneys are going to start failing them and not working properly. Kidney disease is definitely one of the most common diseases that we see. And then cats also tend to have stress issues, and so I see a lot of feline lower urinary tract disease as well. So with the kidney disease, that is something that is something we can slow down with cats. Dogs, when they tend to get kidney disease, they tend to not be able to live as long as cats with kidney disease. Now, there's acute kidney failure and there's chronic kidney failure or chronic kidney disease. And I'm talking about the chronic kidney disease. So when we start picking that up with our cat patients, what we start to do is we want to get them on more moisture into their diet. So as the kidneys not be able to function properly, toxins start building up in their system, and we want to be able to flush all of that out. So I'll start diagnosing and seeing changes in the kidneys as young as 8 or 9 years old. But I can have cats live for years with chronic kidney disease before it really starts spilling over to a point where it's causing worsening of clinical signs. So that is something that I'm talking about with almost all cat parents when I'm doing that blood work, is like the kidney values that I'm looking for and I'm monitoring is super important. The downside of the blood work is you're not going to see the raise of the B1 and creatinine until there's been 75% loss of kidney function. So there's going to be the urine sample is going to be super important to help with us too. And then there's going to be other parameters that we're going to be watching for if we suspect that your cat may have kidney disease. So I tell all cat owners, regardless of age, is I feed mainly dry food, but having some wet food already available is super important, because a lot of the diets, a lot of these diseases can be controlled or slowed down with diet change. So having your cat be able to do a little bit of canned food and dry food is super important in case we ever need to change their diet. And then cats are just dehydrated by nature, which I think then ends up to them having some lower urinary tract issues, maybe predisposing them to kidney disease down the road. So having them have fresh access to lots of different water is super important. So those are the top 5 diseases that we see in practice with our cat patients. And like I said, most of the time diseases are going to start creeping up really between the ages of 7 to 12 is when I'm going to first start seeing some changes. And then from there, we're going to kind of know, like, okay, what diseases is going to affect this little kitty cat and how we could slow that down. And so what you as pet parents, what I want you guys to be watching for is changes in your cat, changes in their behavior, whether they're more playful or more aggressive, whether they're drinking more water, whether they're peeing more in their litter box, whether you do think that they are losing weight. And then always remember that vomiting is not as normal for cats as we think it is. And it's okay for a cat to vomit every now and then, but if you have a chronic vomiter and we haven't addressed it or looked at it, there is probably something underlying going on. And by doing the basic blood work, we could start seeing how we could slow whatever that process is. And sometimes it is just a food change. With my Ricky, when he had his inflammatory bowel disease, nothing worked except a hydrolyzed diet where the protein was broken up so small. For some reason, he reacted to the traditional medication that you would use, and it made his diarrhea worse. But as long as he only ate his right food and he didn't steal any dog food, all was well. So those are just some things that we're going to watch for. My kitty cat, Snowball, he lived, and probably the reason why I became a vet was and when I was 6 years old. And he lived 1 month after I finished vet school, and he had heart disease and he had kidney disease. And of course you would treat them both differently. So with heart disease, you can't give them a lot of fluid because you could overload the heart, but with kidney disease, you want to give them a lot of fluid. So it was very, very difficult to manage both diseases, and I was able to do it fairly successfully, as picky as cats could be, for about 2 years before eventually I do think his body was just shutting down at that point in time. And so we over here at the Welcome Waggin, we love our cat patients. Cat diseases are so unique. Cats themselves are so unique in terms of they don't always read the book on what is going on. And cats, I mean, they just enrich our lives so much. So if you have a cat who hasn't been seen by a vet in a long time and you're struggling to get into the clinic, remember us as house calls. If you guys are clients, are having us see your dogs and not your cats, time to book an appointment and have us come see your kitty cat as well. Again, they could live anywhere from 12 to 20 plus years old, so they have that wide lifespan, and it's so important to keep them comfortable so long, because sometimes, like, I think the mean cats, I do think that they have something going on and it's not being addressed. So there's tons of other diseases that we haven't talked about with cats, but I wanted to give you a broad overview of the main ones. So as we finish up this series, like always, I want to take a moment and just honor those that have passed this past. Last week, we lost Lexus, Sylvester, Bear, and Guinness, and our hearts go out to the families who are dealing with the grief of the loss of those pets. And our thoughts are with you during that grieving period. And as always, I bring this awareness because so many people don't understand the grief that goes with the loss of a pet. I do think we need to normalize pet loss grief and realize that these pets have enriched our lives, and pets sometimes love us more than other people love us from that unconditional love standpoint. So we are remembering those amazing dogs and cats and all they brought to their owners' lives. And in doing so, I encourage you all this week to hug your kitty cat or your doggy extra tight, spend some quality time with them, and just cherish all those moments that you have, because it all goes by so fast. So any questions, put in the comments below. Any suggestions, put in the comments below. Other topics that you guys want to discuss. I am more than happy to go into more detail with any of those diseases, and I look forward to seeing you sometime in the future. Have a great week.